Take one.
Dramatic.
Yeah.
Mark is 24. He's half of a set of twins. He has cerebral palsy. He's spastic quadriplegic. He has a lot of problems day to day. You know, he needs full care, but he enjoys life. He's a happy little man. Before the personal healthcare budget, Mark was looked after by a company called. They sent carers in that Mark knew. They were very good, but we didn't have the flexibility. Told us what they were doing as opposed to us being able to plan to do things with Mark. Personal healthcare budgets we were first told about probably about 3 years ago.
The personal health budget gives really freedom to the person to buy services and things that would help them with their health outcomes. We're not restrictive in what they can use their budget for, and that's monitored basically through their health outcome plan that is agreed with the client and with the care coordinator.
Last year, personal health budgets came into being, and we started the process of Mark and his family acquiring a personal health budget. Della and Nigel were involved in the writing of the My Plan. Indeed, we sat in the same room and typed the My Plan together.
It was done for us then, the personal healthcare budget set up, and we just had to say yes or no. It's made life a lot easier. Mark can choose who looks after him and who helps him with his day-to-day life.
My name's Kevin. I work with Mark on a weekly basis as a personal assistant and a carer. We do everything from inclusion to personal care and just giving Mark the life that he wants. More like a friend, really, in the sense of that's how much of a bond you get working from day to day with someone rather than an agency where you see a vast amount of people through the week.
Most of the budget is on his care. It enables him to do what he would like to do. He can go to the cinema and the theatre. He was doing them before he had the personal healthcare budget, but now he can choose where he goes and when he goes.
We're just off to Dame Hannah Rogers School in Ivybridge, where Mark has weekly session with his physio, either in the hydro pool or on the trampoline. They call it rebound session. He really enjoys it, and it's also good for his health because he gets the physio he needs. Are you doing some trotting? Nice trot down. Awesome, John. It's the Grand National. Finally, we made it.
We've got so much flexibility with what we can do with Mark. If one day we feel like doing something different or Mark's not feeling up to it or he's really up for it, we can switch days, events, or we can do something completely different.
Because he doesn't have so many people doing his care, he is generally more healthy. I mean, more people, bring more infections, don't they?
Continuity of care, and Mark knows who's coming in the mornings to get him ready and get him up.
It would be nice if it's easier to change the My Plan.
You can pick and choose what you want to do, but you're still governed by the actual My Plan, which doesn't give you the flexibility that you want.
Being with Mark day to day, you know everything about him, and that gives confidence not just to Mark and to us, but to his parents as well.
I think the last 3 months has shown, compared to the last time, he got poorly, but this time he's coped with it much better because he's had that control and consistency.
We choose our own friends, so why can't Mark choose his own friends which enable him to have a social life?
There you go, bored now. I don't know.